Thank you very much for that introduction. It's an absolute joy for me to be here this morning as well on such a fine spring morning here in Belfast. It's a great pleasure for me to have this opportunity to address you this morning, and thank you for your invitation. I'm very pleased to be here, and in particular along with Minister Edwin Poots at this joint North-South event facilitated or presented by the Rare Disease Organisations of Ireland and the United Kingdom. The purpose of the meeting is to, as you know, to bring together all of those involved and interested in rare disease issues, including policymakers, clinicians and families on this important day, Rare Disease Day. The theme, Joined Together for Better Care, is indeed very appropriate for the purposes of North-South cooperation in this important area. Rare Disease Day and this event provide an opportunity to raise the awareness of rare diseases with the public at large and the people involved in every aspect of the rare disease agenda, including policymakers and health and social care professionals. The recital to the European Council's recommendation of 2009 on rare diseases described rare diseases as a threat to the health of EU citizens, given that they are life-threatening or chronically debilitating diseases with a low prevalence but at a high level of complexity, and that despite their rarity, there are so many different types of rare diseases that millions of people are affected. It's stated that on the basis of the number of rare diseases existing described today, and their prevalence, the total number of citizens affected throughout the European Union is somewhere between 27 and 36 million. This is why the Council's recommendation called for a global approach to prevent morbidity or avoidable premature mortality, and ultimately to improve the quality of life of persons affected. The Council also acknowledged that there was a scarcity of relevant knowledge and expertise. In recognition of these factors, the Council recommended that Member States adopt a plan to guide actions in the general field of rare diseases. With this in mind, it's agreed that at EU level, where possible, expertise should travel rather than the patients themselves. We must continue and, where we can, accelerate our work to ensure that people with rare diseases obtain access to high-quality healthcare and treatment. It's in this context that both jurisdictions have worked together on the development of national plans for rare diseases. Today, Minister Poots, I know, is publishing and has published a draft framework document, a plan for the care and treatment of people with rare diseases. I very much welcome this work, and as Minister Poots has already said to you, officials from his department and mine have been in contact and continue to be in contact to discuss our approaches to the development of our respective plans. These engagements have been very positive, I know, and helpful, and they have deepened the cooperation between North and South on rare diseases. The plan of my own department is almost finalised. The important work of developing the National Plan for Rare Diseases continued under the steering group of stakeholders established by my colleague, the Minister for Health, James Riley, in 2011. We've benefited from 2 national consultation days, as well as an online public consultation, and I very much appreciate all of the feedback that we have received. The remit of the steering group is to develop a policy framework for the prevention, detection and treatment of rare diseases based on the principles of high-quality care, equity and patient-centredness. The plan will deal with the prevention, diagnosis and care of people with rare diseases, enhancing access to orphan drugs and technologies, responding to the needs of rare disease patients and their carers, and research. The European Council recommendation on rare diseases recommended, amongst other things, that Member States identify appropriate centres of expertise throughout their national territory, foster the participation of centres of expertise in European reference networks, and that they organise healthcare pathways for patients suffering from rare diseases through the establishment of cooperation with relevant experts and the exchange of professionals and expertise within the country or from abroad where necessary. A key priority is the development of networks for provision of safe care to all patients with rare diseases in Ireland, whether provided from a recognised national centre of expertise or by linkage through the patient's healthcare provider to recognised European reference networks, or ERNs. The Council recommendation refers to the added value of European reference networks due to the rarity of these conditions and consequential scarcity of expertise and the relatively limited number of patients within a given country. Gathering expertise at European level is important for ensuring access to accurate information, appropriate and timely diagnosis, and high-quality care for rare disease patients. Rare disorders require highly specialised, multidisciplinary medical teams and social service providers. Concentration of expertise in a physical or virtual structure brings together competencies and reduces healthcare costs by contributing to shorter delays in diagnosis and better overall healthcare. Informal collaborations for clinical care and investigation exist between Dublin, Belfast, and European centres for many genetic and metabolic rare diseases. We must build on these collaborations, given our mutual objective to facilitate care and treatment pathways for people with rare disease on the island of Ireland. My department's steering group is also considering for its report the development of a national office for rare diseases. Its purpose will be to facilitate the coordination and timely access to centres of expertise for rare diseases, both nationally and internationally. Such an office could act as a national point of reference on services and diagnostics, on care pathways, and on information relating to rare diseases. The report by the Department of Health on recommendations for dealing with this issue, including the establishment of a national office, is, as I've said, being finalised, and the Department's officials are meeting with our Health Service Executive now regarding its implementation. The HSE has established a national clinical programme for rare diseases. A national clinical lead has been appointed and a programme manager is in place. The programme aims to improve and standardise patient care for individuals affected by increasing detection and prevention, facilitating early timely diagnosis, intervention and coordination. The programme is currently progressing with the establishment of a national working group consisting of experts in a number of different fields in order to identify best practice. The programme will also be supported, I should say, by the advice and guidance of a clinical advisory group appointed by the Royal College of Physicians of Ireland. A key priority of the programme is to assist with the provision of information and helpline access to patients and families through the establishment of a centralised rare disease information office. It's envisaged that a national rare disease programme would over time collate and assist with developing national treatment guidelines, standard operating procedures and care pathways for many rare disorders in collaboration with the designated reference centres. Would also develop care pathways with European reference centres for those so-called ultra-rare disorders where there may not be sufficient expertise in Ireland. Ladies and gentlemen, both jurisdictions, in partnership with stakeholders, have worked hard at developing their national plans for rare diseases. It is important and indeed essential that we take the opportunity afforded by today's meeting to share our experiences of these developments with the wider community of rare disease organisations. I want to thank Alistair Kent, Christine Collins and Philip Watt for their kind invitation to be here today. I do look forward to hearing more about Northern Ireland's plan, the publication of our own plan in the South, and deeper cooperation on rare diseases between both jurisdictions, as I'm sure you do, and as you've gathered here in such impressive numbers this morning for this meeting and this conference. Can I just agree with the remarks of Minister Poots at the outset of his contribution, where he made the point, if I picked him up correctly, that in health policy, perhaps more than any other, change is incremental. and change is sometimes frustratingly slow. And I know that people who are involved in NGOs and people who are all involved in patient groups often experience that frustration. And I appreciate that and understand that. It won't come as any consolation to you for me to say to you that I too, as a minister, very often experience frustration at how slow it's possible for us sometimes to make progress in these important areas. But I agree with Minister Poots when he says this, that it's so vital that people remain tenacious, that you stick with the plan, you stick with the programme, you continue to bring pressure where it's needed, including on government and on policymakers, and that by your efforts, even if it does happen more slowly than you and I would have liked, you will achieve change and you will achieve your objectives. So I want to encourage you in that, encourage you in the course of today to exchange information, have an opportunity to understand better the developments that are occurring and continue your pressure for change. And I congratulate you on your work and thank you once again for inviting me to be here.